Good evening. Welcome to our Meet the Makers series. My name is Elena Oren, and I'm a team member of the National Foundation of Swallowing Disorders. We're so glad that you've joined us here for our final webinar of 2023. Our goal with Meet the Makers is to offer our community access to those who have created products specifically for people with swallowing disorders. So the makers in this series are volunteering their time to share this information. They have not been paid to participate in this series, nor was it required that they be a past or current financial sponsor, although many companies, including CranioRehab, are financial sponsors of the foundation. So the series is not meant to be promotional, but rather informational. We want to give you the opportunity to ask the creators of these products your questions and to also learn more about how these products help people with swallowing difficulties. We also want to give you the ability to make connections so that your voices feel appreciated among our industry partners. As a brief disclosure, the National Foundation of Swallowing Disorders President Ed Steger and Executive Director Elizabeth Daly have excused themselves from emceeing this webinar as they are financial stakeholders in one of the products that is distributed by CranioRehab. We thank you for joining us this evening and hope that you find this series to be helpful. Thank you also to those of you who have made a donation either with your registration or who have become members. It's really only with your financial support and the financial support of our community as a whole that we are able to continue to further our mission. If you've participated in one of our webinars previously, you're likely familiar with our system. So you'll be muted throughout the presentation, but you're encouraged to ask questions at any point during the presentation by just typing them in the Q&A box that you should see in your panel to the side. There are 30 minutes reserved specifically on this call just for questions, so please do not feel shy about asking. We will also record this presentation and make it available on our website within the next few days. And while there are no ASHA CEUs that are provided, you will receive a certificate of participation following the broadcast. With that, I want to provide a reminder that tonight's broadcast is for informational and educational purposes. So both the National Foundation of Swallowing Disorders and tonight's speakers do not intend to provide any diagnostic or treatment advice or recommendations. But if you do need assistance identifying a swallowing specialist for either yourself or for a loved one, please do reach out to us via email. We're happy to make those connections. Now it's my pleasure to introduce the CEO of CranioRehab, Rob Christensen, and speech-language pathologist, Sarah Schumann. With that, I'll turn this over to Sarah and Rob, who have volunteered their time to present for our Meet the Makers series.
Great, hello.
Hello, everybody. Thank you so much for joining us tonight. Rob's just going ahead and sharing our presentation, so just bear with us for a second.
Okay, I think we're set up. My name is Rob Christensen. I'm the CEO of Craniomandibular Rehab. I'm with my colleague, Sarah Schumann. As you can see, we're also on all the social media, so we'd be more than happy if you could follow us on Instagram or Facebook or LinkedIn. We're working on a lot of new things, and also interact, to really help you with your patient care that way. So Craniomandibular Rehab, or CranioRehab, was started in 1995, and since then we've grown to design, develop, and distribute products, basically for the head, neck, face, and jaw. And then our mission is really to focus on patients. So we're really passionate about care for this area. So we're dedicated to improving care for patients of the head, neck, and jaw with needed medical devices. As we've seen over time, this is a really underserved and underinvested sort of group and area, because it's split between sort of medical doctors, dental dental schools, multiple specialities, so physical therapists, occupational therapists, speech pathologists, and then it also has sort of mixed and weak insurance coverage. So it makes it very complicated, but we know that we need new ideas and products along with sort of coordinated action to sort of improve the care and insurance coverage for, all of these, different issues around sort of the head, neck, and jaw. So we're going to be focused. We really look, a lot of the topics that we focus on are sort of like TMJ, trauma, major joint issues, craniofacial pediatrics, cleft lip and palate, burns, scleroderma, Sjogren's disease. But by far the biggest one is generally side effects from either radiation or surgery of head and neck cancer, as well as the cancer itself. So we sort of picked a focus on sort of some of those. So trismus, including microstomia and oral contractures, and then also dysphagia and xerostomia out of sort of our products to sort of talk about for today. So I am going to start off focused on trismus, and this is sort of what really our company started out with. We were really focused a lot on TMJ disorder and post-surgical care from that. So from that, we grew into really working on function of the jaw and face. And trismus, sometimes called lockjaw, is basically when you can't open your mouth. So it's most commonly caused from radiation, fibrosis after head and neck treatment. Trismus diagnosis is very highly correlated to sort of the size of your body, but on average with adults, they've set a limit of about 35 millimeters. So above that, you are sort of within normal function, but below 35 millimeters, you have limited function. And it starts to impact, your ability to, eat things, make, sounds for speaking, different things. So we have scales, but we also have a basic diagnostic, which is sort of using your fingers. And the average person can fit 3, their pointer, middle, and ring finger between their teeth. But that also works as a simple way to measure opening, especially for pediatrics and people of different sizes. But we also have some tools to do that. So we have some different scales. So there's a rotational scale that measures opening. We have a prong scale, which sort of slides in, and it allows you to see how open you are. And then this is one that we've just developed in the last year. It's sort of a see-through one, and it allows you to see opening, but also movement of the jaw as you go, as well as sort of tongue movement. This is probably your favorite part of all webinars is looking at people's open mouth, but you can see tongue movement to actually measure, different motions, but actually be able to do that in a systematic, quantitative way going forward. So the biggest cause for trismus is head and neck cancer radiation, and it's by far the major risk factor. But there's also things like if you already have a limited opening, if you have a flap surgery, age, there's some other things there. But basically, patients with radiation especially to the pterygoid or masseter muscles, have a very high chance of developing trismus after radiation. And the thing with especially head and neck cancer radiation fibrosis is that it's very gradual. So usually what happens is you'll end up getting radiation and it causes sort of immediate, almost like a sunburn with some swelling and heat. But then slowly over time, it actually sort of creates scar tissue everywhere. So whether it's around, skin, muscle, like veins and arteries, it's really disorganized and it grows everywhere. So that's partially what makes it much harder than if you had major trauma, you'd have a big scar, but that is all generally in one direction. Whereas the radiation fibrosis is really mixed up. So it makes it much harder. And then because you have multiple treatments, this slide sort of shows that it basically takes about a year as it slowly grows. So a lot of times what happens is you don't lose opening, the patient doesn't lose opening right away, but slowly over a year, they start to lose 2, 3, 4, 5 millimeters a month until they have developed trismus. And then, one day they're, can't get a hamburger in their mouth or having trouble with a fork, different things there for opening. And then the other thing is that it never stops. So even after it's developed, that scar tissue continues, that fibrosis continues to shrink over time. So you lose like 1 or 2% every year after that. So it's not uncommon for us to see patients 10 years after radiation, and only then have they actually like slowly closed down. And the radiation fibrosis is much harder to treat and to stretch than like post-surgical scar tissue for stretching or joint issues. But the good thing is trismus is preventable for head and neck cancer radiation. So it actually really benefits patients to do stretches either during radiation if they can tolerate it, or as soon as they can afterwards, to maintain as much opening as they can. And that there have been a number of studies that have shown that it reduces how much loss, and then it also reduces how many patients actually fall into like a trismus zone, so the severity of the trismus itself. So it's both preventable and then it's also treatable. So it's very slow, but you can treat trismus from radiation fibrosis to increase your mouth opening. And that sort of leads us to our product, which is the OraStretch Press, which is this. And the OraStretch Press is essentially a jaw motion rehab system. So it's handheld, patient controlled, and you do stretches by squeezing the handle. It was designed to move along an average adult rotation of the jaw. So it actually sort of rotates around with the jaw. And then it can also sort of improve pain and motion in the joint. It's a very conservative treatment and has, especially for head and neck cancer patients, some insurance coverage. So this device opens to 50 millimeters. So the average adult opens to 50 millimeters. And this allows you to actually, especially with prevention, try to keep that opening as wide as you can. But then if you've already lost opening, then open farther to be able to get back to a full opening. We have a number of different sizes. So this is sort of our standard size. This will fit sort of anyone older than 10 years old. So it's very broad. But then there are standard pads, which actually sort of work like a custom mouthpiece. So sort of indents where your teeth are to hold them in place. There's also a dentulous pad, so patients missing teeth. It's much softer, so it's a much thicker and softer pad. And then those can be cut sort of like this to fit where there are and aren't teeth for the patient to best, spread out that pressure. We also have like a pediatric size. So that's generally for very small children. We've added an extended size. So this one has a little clip-on that allows the patient, if they have a severe under or overbite, or sometimes it just better fits their rotation. And then we also have an anterior version, which basically only sits on the front teeth, so that if you have like a mass or like a flap, some different things, and can't insert the device all the way to the back, it'll sit better sort of in the front of your teeth. Excuse me. So of those different device types, there's the standard, the pediatric, and the anterior with the different pad options. And then on top of that, you can add the extended bite plate or like the power band. So this sort of goes over those different sizes and options there. And we've really expanded that to better fit more patients. And that's really been key for us of, the adult probably fits 95% of patients. And then how do we keep tweaking it and improving it for the other patients that it's not a perfect fit? The basic rehabilitation with the device is pretty straightforward. So you insert and you squeeze for a light stretch. A lot of patients, I think it sort of skews towards men, really want to get two hands. They want to squeeze as hard as they can. But with that, you actually risk tearing the tissue. So the idea is to do like a light stretch, like a 2 or a 3 on a scale of 1 to 10. You want to feel the stretch, but you don't want to push past that, and you want to hold that. So especially for radiation fibrosis, you want to get a stretch and then hold it for longer periods to actually stretch out that tissue and then hold it so that it sort of biologically induces the tissue to both elongate and then also extend. And with that, it's common, especially at the beginning, that the patient might feel a little bit of light pain, sort of like working out, but it should never be like sharp pain over time. And if so, then you want to check because there might be something else going on that's causing that sharp pain. We also have protocols for like joint disorders and then for non-progression. So if a patient is, they've increased their opening by 10 millimeters and they're doing their exercises every day and they can't get past that, then we have some other different protocols that they could try to actually improve the opening beyond that. And one of them is our new power bands. So our power bands essentially allow you to convert this device from being just manually squeezed into putting out pressure and pretty significant pressure. So you can start with one band and then build up over time to 3 bands. And essentially you just put it in and let it do the stretching for you. So with that one, you're able to do it. You want to build up to like 3 30-minute sessions a day. So that does that much longer stretching of those tissues to actually increase the opening, which especially if you've like hit a plateau or are trying to like really rehab some tough fibrosis, that is like another like great option for that. So what we do is we've sort of like laid out a process of when we think it's most efficient and cost effective to order the device for patients with head and neck cancer. So if they have head and neck cancer, do they have, and this is one of the things that really sort of throws it off, is that this device is really more focused on the head part of the cancer than the neck part. So if they have throat cancer, they're very unlikely to actually develop trismus. But if they have sort of oral or nasal cancer up here, then they have a much higher chance. And then if they get radiation to the pterygoid or masseter, then we would recommend that they order a device preventatively, because especially with radiation to the pterygoid, there's like a 90+% chance of developing trismus. And the pterygoid is a little muscle like right here that pulls back. So it actually like clamps that jaw closed, and it's very small. So even small limitations in that muscle can really increase your trismus. But otherwise, we recommend that you just wait and see. So if you've lost like 4 or 5 millimeters of opening in 1 month after radiation, then it's something that we'd want to try to order like sooner than later. But if you're, losing a millimeter a month or not much at all, then it's worth waiting to see if you need it later on. And then to order the device, we have a lot of different ways to do that. So we will work with facilities to do that and have some special pricing there, but we also bill insurance for this device. So that we have a simple sort of prescription order form, which there's sort of a picture of, and what it has is information about the prescriber, the doctor, if there's a prescribing like partner, like a referring provider, so a speech pathologist, physical therapist, they can put their information there as well, and then the patient information, and then what we'll do is we'll check the patient's insurance to see if they have coverage. We'll double check to make sure that the diagnosis codes can maximize the chance for coverage, and then go from there. So, and then we call the patient. So that's sort of a quick overview of the OraStretch Press for trismus. And now I am going to pass it over to Sarah, and I'm still going to be in control of the slides. So, be patient if I'm not right on it right away. But here we go.
Patience not my strong point, Rob, but I'll do my best. All right, everyone. So I'm going to dig in real quickly into microstomia, which literally means small mouth. So microstomia is a significant reduction in oral aperture, particularly at the oral commissure, involving the orbicularis oris muscle. So that goes around the lip area. So think about a small lip area here. And here are some pictures of microstomia for you to look at. It results in functional impairment and causes difficulties with nutrition, with speech, oral hygiene, and dental care. It can also cause issues with intubation and then, of course, overall quality of life. So this is the OraMPA or OraMPA, however you want to call it, microstomia device. It's a handheld single patient device for the prevention and treatment of microstomia. It provides the patient with multiple stretching options, manual, static, and dynamic. The device includes a OraMPA appliance, a pack of elastic bands for dynamic stretching, and a pack of wraps for static stretching. So you have a few different options there. It comes in 2 sizes. So we have our standard size, which is what you're seeing in this picture. And then we also have a severe extra small size, which we're currently using with really, really limited mouth openings. So we have some younger children using it. And then as you can see on that slide, there's a few different contraindications. As previously mentioned, the device offers 3 stretching options. You have the manual stretching, which allows the patient or a therapist to control how much pressure is applied by squeezing with your fingers. So that's that picture on the left. And then you have that middle one, the dynamic stretch, and so that's using the bands there. This is best for patients with lip excisions, radiation fibrosis, and those who are long-term post-burn. The dynamic bands allows for adjustable pressure and permits progressive controlled tension. The size of the elastic band used determines the amount of pressure applied against the lip commissures. So that's that middle picture there. And then that last picture on the right, the static stretch. So static stretching holds the stretch at a fixed location and pressure. This is indicated for patients who have had chemical or thermal burns and may be best utilized during the first year to prevent and minimize contracture occurrence. No matter how you plan to use the device, first wash it with soap and water and dry with a towel. Then, if applicable, add a dynamic band or the static strap. To insert, you squeeze the upper arms and lip cups together. You place one lip cup inside and against the lip commissure, rotate and place the opposing lip cup against the other lip commissure. Then, if applicable, follow the steps for securing the static strap. Lastly, release the upper arms, allowing the device to expand and press the commissures apart. And I have the device here so I can show it to you. So this is it here. So it just goes right into the lip commissure. And there it's in between. And so you can stretch manually, or then of course you can use the strap or those dynamic bands. All right, so now I'm going to move on to facial contractures. Stanford Medicine describes contractures as an abnormal occurrence that happens when a large area of skin is damaged and lost, resulting in a scar. The scar formation pulls the edges of the skin together, causing a tight area of skin. The decrease in the size of the skin can then affect the muscles, joints, and tendons, causing a decrease in movement. So you can see how that would affect each of these patients that you would see in these photos. So the OraPlace contracture tools are handheld single patient use for intraoral stretching. They provide a 3-dimensional stretch working from the inside out. These tools allow the provider to start rehab and prevention early on. In the case of burn patients, they may be utilized a few days after grafting or surgery versus weeks or months. The tools come in 3 shapes: the bar, the ball, and the boomerang, and then each of those comes in 3 different sizes. So you can see how each of these different sizes would be used in different parts of the oral cavity. So the ball shape targets areas with deep pockets such as the nasolabial folds, the smile lines, or by the chin. The bar shape targets the mental labial junction, so that lower lip area, or the upper lip and philtrum. The boomerang shape is angled for comfort along upper and lower jawline. There are many benefits to using these tools. They provide slow graded stretching, which addresses both the muscle and the skin at the same time. They improve range of motion. They improve symmetry. They also can improve lip closure, benefiting drinking, eating, and speech. And lastly, but not least, they're easy to use and accessible for patients. And then, of course, with these, we definitely see use in patients other than just burn patients. So anyone with contractures of face, and that can also be those head and neck cancer patients. Okay, so to start, you would find a size that provides a tolerable stretch and insert into the target area in the oral cavity. It's okay to start small. If the tool slips out, then it means it's too small. Move up inside if the patient has no physical feeling of a stretch, or if there's no visual cue of a stretch and there's no resistance against the tool. Stretch the patient's comfort level. So you're thinking on a scale of 10, around a 4. For the prevention of contractures, you want to start as early as possible. So for burn patients, this can be used as early as during acute care. So you can take a look here at that picture and you can see how she's using it intraorally to stretch in that cheek area. And this can definitely be used for patients who've had surgery and scarring on one side of the face, and it can really help with that symmetry. All right, so in this next section, we're going to take you more in depth on how to use the tongueometer device as an additional tool in your dysphagia rehabilitation toolkit. The tongueometer is a lingual strengthening device designed to measure and exercise tongue strength and endurance. It can also be used to measure and exercise lip strength and endurance. The handheld device includes a replaceable textured air-filled bulb that a user applies pressure to using their tongue and pressing it up against the roof of their mouth. The tongueometer pairs using Bluetooth to a free downloadable app that is compatible with both Android and iOS smartphones and tablets. So you can go ahead and download that app if it's something that you're interested in checking out. There's no fee. The app shows, stores, and can send exercise data remotely. The app can be downloaded on any number of phones or tablets without needing to purchase a device. The tongueometer device can be used to assess lingual strength in just about any patient. It is most commonly being used in patients with stroke, head and neck cancer, and neurodegenerative diseases. So as you see on this slide, using the device and the app, you can determine both the patient's maximum strength and their maximum endurance. Once these two assessments are completed, you can decide whether a patient may benefit from using a lingual strengthening device as part of their rehab program. While the norms are still being established in healthy adults using the tongueometer, preliminary data to date has shown concurrent validity between pressure measures with the tongueometer and the IOP device, which does have established norms. Once you've determined that your patient may benefit from a lingual exercise program, you can determine the appropriate treatment regimen for them using the two exercise modules. The repetitive strength module is designed, you guessed it, to help increase tongue strength through repetitive isotonic exercise. The app shows visual biofeedback and also provides a counter at the bottom so that the patient does not have to count the number of successful repetitions they performed. The isometric endurance module is designed to increase lingual endurance. Again, the clinician determines an appropriate target range and sets the number of seconds for which the patient should maintain pressure. There's a few really great benefits of using a device such as the tongueometer. There is the biofeedback that it provides. So there's visual, there's auditory, and there's tactile biofeedback that you can turn on and turn off, which can really help motivate patients. You also have the option to adjust the exercise parameters to challenge the patient. One of the nice features about the tongueometer device that differentiates it from other biofeedback devices is the ability for the patient to view and send their exercise data. From within the application, users can view their progress report with the option of viewing by the day, the week, the month, or the year. There's also an option on this page to reset all of the data that's been collected. So this, for you speech therapists, is particularly useful if you're using the same phone or tablet with multiple patients. The patient also has the option to export their data report remotely with the click of the button. So this can be useful if the patient's using it at home and then they want you, their therapist, to have access to their data. All right, so next we're going to speak briefly about xerostomia or dry mouth. To begin speaking about xerostomia, we need to first discuss saliva. I know it's a weird thing to think about. We don't think about it a lot, but it's pretty amazing substance. Saliva is composed of water, electrolytes, and organic compounds. It performs a variety of functions that you can see on this slide. So it lubricates and helps clean the mouth. It modulates oral pH and maintains dental health. It has antibacterial properties that prevent infections. It begins digestion and also aids in speech production. Xerostomia has a wide range of causes, as you see on this slide. For the head and neck cancer patient, xerostomia is the most common side effect of radiation and chemotherapy. So here's our Salvate system. This is a device that patients can use overnight, or we also have some patients that like to use it during the day when they're at their computer and they don't have to think about sipping water. It was really designed for those patients who are just struggling with such dry mouth. It's frustrating them. They have to wake up to sip water, and we wanted to find a way so that they could sleep throughout the night. So you have that little blue spongy piece which sits under the tongue or in the pocket of the cheek. It's connected to that box, which is the pump, and it's connected to that bottle which you put water into it. The most it will do is release a little bit of moisture into the oral cavity once a minute, and then from there you can actually reduce it. A patient does need to be able to safely sip water and also manage their own secretions to use the device. We don't have insurance coverage for it at this time, but we do have a 60-day trial period, and if the patient decides that they don't like it, they get about a 75% refund by returning the device. All right, next up we have our NutriSqueeze bottles. These are for patients who need to access food in different consistencies. So we have straws for thicks, we have straws for liquids, and we have a whole bunch of different options there. We have soft straws, we have thicker straws, we have stiff straws, and then the bottles come in 8 and 16 ounces. They're really convenient because you can just wash them right in the dishwasher. They're easy to use, they're squeezable, so if you have a patient who can't suck, they can still access their food. All right, and now in terms of ordering, I know Rob briefly touched upon the OraStretch Press, which we do process insurance for. But there's other ways to order as well. So we do accept POs, so purchase orders. We do accept ordering on our website with a credit card, so a patient can do that as well. If they want their insurance checked, then we do need that prescription order form. But typically, if you're prescribing it, if you get that prescription order form in, we will then check it and we'll reach out to the patient directly. That's primarily for the OraStretch. The other devices can be ordered directly, and they can be ordered, like I mentioned, with a purchase order by credit card. You can also call us to order them as well. All right, so I'm gonna pass it back over to you, Rob, to talk about product development. Oops, you're on mute.
Yeah, so one of the last things that I just wanted to highlight, especially for a presentation like this of Meet the Maker, is about actually making things. So we are really, and as Sarah knows, I really love working on these new products because we know how needed they are and how important they are for people. So a couple things in the last year that we've developed, not only these scales, but we worked with some oral surgeons on this MBI imaging prop, and that is to make sure that when an oral surgeon orders MRI with an open mouth for a joint, that they actually get a picture that had the mouth open. So there was a lot of waste and bad images. We also worked with an innovation office at either university or hospitals often have innovation offices. And we worked with them to essentially connect with 2 speech therapists who developed the OraPlace tools. And then we're working on distribution and manufacturing of those. And then the last one is the OraMPA device. And that one we basically picked up and then worked to improve when sort of other options sort of fell off the market. So it's something that there's lots of different ways that we come about ideas, but also different ways that we can work to develop these products. And we've really developed systems to develop these sort of rapidly and efficiently. So, some of these devices, as I often explain, a pharmaceutical is considered an orphan drug if it has less than 100,000 patients. Some of these tools, like the OraPlace, there's only an estimated 5,000 major facial burn patients. These are orphans of orphans, but they need serious support. So we're very interested, and we've worked on ways to be able to provide products for these smaller groups of patients. So I think a question that I would really want to ask to you guys is, what issues are you guys seeing that are or facing that sort of get pushed to a side and or don't think matters too much? Because I think a lot of times those are great places to find ideas, or just if you have another idea, we'd be very interested in hearing about it and possibly working with you to improve options for these patients. So to end, thank you very much. We have basically a version of this on our website and webinars, but then you can always reach out to us through our phone, email, social media. And we just want to thank you and the NFOSD for having us, and we're looking forward to your questions.
Thank you so much. It looks like we got some great questions in while you all were presenting. So one of the questions that several people had was about the nature of cost, which totally makes sense. The provider brains are going. So do you all see any trends in specific insurance companies that tend to be more willing to cover these devices? And then also, what is the price range for patients who want to purchase these devices privately?
So specifically for insurance, the only device that is consistently covered is the OraStretch Press. And that one we actually have over the last 15 years seen an increase in coverage specifically for head and neck cancer patients. There has been sort of consistent research that has shown it to be beneficial for trismus. But the biggest challenge for this, and I would say all of the products, is that they are still sort of small numbers of patients. So my estimate is that serious trismus users are about 10,000 a year. It is difficult to get them all in one place for studies. So the biggest one that insurance that doesn't cover it is United Healthcare, and that falls under a policy that they just consider investigational. And basically what that means is that there haven't been meta studies of other studies to show that it works. But it's very difficult to get these studies. And on top of it, part of it is sort of the cost itself. So these devices are in certain ways pretty inexpensive compared to like pharmaceuticals or other medical devices. But for individual patients, most of these devices fall between $100 and $500, and that is still a substantial amount of money, and we understand that. So I think that is the challenge, is that we do a lot of things, especially with the OraStretch Press. So we bill insurance. We have discounts for patients that don't have insurance coverage, that are like Medicaid or have like hardship. The other thing that I'll just say there is that we can work with you. So any patient who does not have the financial means to be able to cover it with no insurance coverage, we will absolutely work with you to make sure that that patient gets the device and the therapy that they need. And that goes for all of our devices. The other products, like the OraMPA, OraPlace, Tongueometer, those ones do not have insurance coverage, so they're all out of pocket. And those ones, again, are generally a couple $100, depending on the device. And we will do like payment plans, and we do have some discounts, but this sort of gets to the problem that I was talking about at the very beginning, is that there is not great insurance coverage. So we have seen a number of companies try to get insurance coverage for devices similar to the Tongueometer, or things in the past, and they got feedback of like, speech pathology doesn't need any more codes. So like they didn't give codes to allow like billing for these things, and especially with these small patient numbers, it makes it very challenging to sort of get the insurance coverage. So it's a fine balance that we're really working on, but and I know that goes deeper than just what they cost, but.
And one thing I just want to quickly interject there that I think Rob just forgot to mention was that with like the OraStretch Press, he mentioned, how United Healthcare doesn't cover it, but we do have great coverage with traditional Medicare for head and neck cancer patients. And always just get us that prescription order form, because we do the checking for you. So we'll check the insurance coverage, we'll talk to the patient, we can set up payment plans. So if, and there's no, just because you submit the prescription order form, it doesn't mean that they have to purchase the device. We'll do it regardless of whether they're going to purchase the device or not. So it's always worth getting that to us so that we can check the coverage.
Absolutely, thank you. And we also had someone ask kind of a funny question. What is the most creative make your own version of one of these devices that you've seen either a patient or a clinician develop and or use?
We've heard a couple, like a number of different things. I think the strangest one was, this was secondhand, but essentially someone created a hook and they would hang a weight on it. So they would hold their head up and it would pull their lower jaw down. I think that's one. We recently were at the AMIS, which is American Association of Oral Maxillofacial Surgeons, and a doctor was like, I don't do that. I just give them a racquetball and have them shove that in their mouth. And you're like, that is not a professional response to like these issues. And you know, and it doesn't always work, but we've heard some like, you know, some funny things.
We also have some logistical questions about some of the specific devices. So in regards to the tongueometer, we have someone who's wondering if that is a device just designed for single patient use, or if that can be used across different patients.
So that's actually a great question. So it can be used for both. So if a patient wants to purchase it and use it at home, they can do that. But so I have it here so you can see it. The bulb is replaceable. So if you're using it in the clinic, you can clean the device and put in a fresh bulb and use it across different patients. And you would just reset that data on your phone in between so that you would, you know, clear it for that next patient. If you wanted to hold on to this bulb, so say you used it with patient A and you were going to see them again next week, you can clean this blue part, bluish green, whatever you want to call that color, with a little bit of soapy water, and then let it dry, put it in a Ziploc bag with your patient's name on it, patient A's name on it, and you could use it with them the next week. But the bulb is single patient use, whereas the device itself can be cleaned and used with many patients.
Awesome. And then in considering the outcomes, or at least the outcomes that you have seen or heard about yourselves, what difference, if any, do you see between the tongueometer compared to those for the IOPI?
So the main thing in terms of the tongueometer and the IOP is that the IOP is very expensive. So it makes it less accessible for patients to be able to purchase and use at home. So that's a big thing. The tongueometer is just under $400 currently. And if you are interested in it, I recommend following Tongueometer on Instagram because they do periodically put coupons for the device. So that's a good way to just help a little bit when you're trying to purchase it. Another thing is that the tongueometer has a textured bulb, if you can see that there. Which helps with slippage on the tongue. So it really helps with placement and maintaining that placement. So that's another really great thing. And then as I mentioned during the presentation, the tongueometer has such great biofeedback options. It has that visual one where it will show you when you've hit your target range. It has an auditory that can ping as well. And then even on phones, it can vibrate. So for people with visual impairments, that can be really helpful. And it's also just really like anybody knows, right? You're playing a game, you want to see you scored a point. So it's nice to see that you're actually achieving, you know, your targets and you can keep track of it.
Absolutely, thank you. I'm also wondering if you could talk a little bit about the personalization process for the OraMPA, and if it's able to be personalized according to size, or if there's some kind of like minimum opening that you need to see in order to insert the device.
Sure. So there's a standard size, which actually allows you to get about, it's about like 12 millimeters. So with a very, very small opening, you are able to and sort of slide it in. So even with that like standard size, it should fit like a very, very large number of patients. But we did have, I think, was he like a year old? I don't even know if he was a year old. We recently had a patient, or a couple, like 2 years old, but he had like a major craniofacial disorder. And he had like an incredibly, I mean, just tiny, tiny mouth. So we developed the extra small that it goes even a little bit smaller, closer to like 8 to 10 millimeters, but it's not as tall. So that one would sort of fit in there. But overall, you know, so those devices off the shelf should fit almost any patient, the standard should. But they were also designed in a way where, you know, if you're working with a prosthodontist, if you're working with an orthodontist or someone else at the hospital, they could easily add, you know, acrylic or other materials to it to better fit like a patient's like mouth and like lips.
That's awesome. Yeah. And then for a patient who is undergoing radiation, do you have recommendations, or what have you seen in terms of the timeline of using these devices, either while they're actively undergoing radiation or if they have very recently completed the radiation process?
Yes, so a lot of that just really depends on the patient and their tolerance. We do have patients who will start using, say, like the OraStretch Press while undergoing radiation. I think that's fantastic for those high-risk patients, but not all patients tolerate it. So then we recommend that they start using the device as soon after as they're comfortable to begin doing that process. That's something that the clinician can determine with the patient. They know their patients, they know what their kind of limits are, right? And so you have some patients that really just do great getting started earlier with radiation. Some even might get the device right before they start radiation and start using it. And that's great, but not everyone can tolerate that. So we do recommend using it as soon as possible, but that's something that the clinician can work out with their patient.
Yeah, that makes a lot of sense. And I know that we talked about the ability for the tongueometer to be reused when you kind of change out those bulbs. Is something similar possible for the OraPlace tools as well, or what does that do?
Or not. So none of the other devices, they're all single patient use devices. And most, I mean, the main reason is that most of these tools should be used multiple times a day, every day. So it's, you know, they need to be doing stretching multiple times a day. So it's, they were designed for that sort of therapy and not just for sort of like in a, like in between by like a therapist or a doctor.
And then with the
and they've been in someone's mouth, so it's
yeah, I was
not
gonna
like
say too, I have them here. Like with the OraPlace tools too, the texture of the device itself, if you're cleaning it with something that then would allow it to be used with a different patient, it can actually degrade the material, and so we don't want that.
We also have a question that's a little bit more geared towards therapy and using these devices specifically to treat trismus. So the question is, after the trismus is improved, after you've used one of these devices, does it generally stay improved, or do you have to continue using these devices for maintenance? What have you seen, or what have you heard?
That's a great question, and I think a really important one. So if you're using it for that radiation fibrosis to stretch it out, we do know that unfortunately, if they stop doing stretching, it will tighten back up over time and they will lose opening. So we do recommend that patients continue to use it even after they've hit, you know, a place where they're comfortable, a good target, and they're happy with how open their mouth is at that point. However, I understand like using something 3 times a day after you've hit your target is unlikely, unless you're going to get like rewarded with a chocolate ice cream every time afterwards. I don't know. But so what I recommend is using it at least once a day. Make it part of your routine. So brush your teeth, do your stretches, go to bed, right? So that way it's like incorporated in a way that's easy to remember. And then if you start to find that you're losing opening again, you can bump it up and you can start using it more times a day. But typically if you're using it once a day after you've hit that target, it should really help you maintain it there.
I think it's also just sort of about the timing as well, because especially with radiation fibrosis, if it's like happens pretty quickly, that you can like get it back up, that's better because it's easier to like treat and prevent. But over the long term, it can take, you know, you might be adding like a millimeter, like a week or 2 millimeters a month in opening if you're doing it pretty consistently. So it can be very frustrating for patients over time. And is one of those things that, you know, it really helps for them to do it longer term, but yeah, they just really want to keep like an eye on it.
Absolutely, yeah, that makes sense. And we have another related question about trismus from an SLP who says, I have a patient who has had extensive jaw reconstruction. He has many years post-treatment, she says greater than 10 years. His ENT has told me there is minimal risk of breaking with trismus treatment, but has also stated that he has a very poor prognosis for any improvement. He previously had therabite, but lost it several years ago. She's wondering how how to best like navigate, I guess, recommending one of these devices, given the history of that patient. Again, knowing that you are not this patient's clinician and do not work with him.
Sure, yeah. So usually if the doctor clears it, then we're comfortable recommending it to a patient. We want to know that it's cleared by the doctor. Because it is such a gentle stretch too, I'm not too concerned there in terms of, all of that he's already undergone. I would say that it's worth having the patient's insurance checked to see if there's coverage. And we also, for patients that are switching from a therabite to an OraStretch, we do have some possibilities there as well. And then we have those power bands. So for a patient who doesn't have a great prognosis of necessarily getting somewhere by doing the regular stretching, those power bands can be helpful because it does allow for a longer stretch. So that might be something that patient wants to try. And they could always try like the traditional stretching first and see how that's going. And if it's not doing what they want it to do, then we can talk about using the power bands.
Yeah, some great ideas there. Rob, it looks like we do have a person who did answer your question when you asked about some upcoming or some current areas where people feel that they need some tech or device related ideas. So this comment says, the issues that I see are with velopharyngeal insufficiency post radiation. So potential idea for you there.
Yeah, and for anyone with ideas, I know it's not on this slide, but you can reach out to us. You can reach out to outreach@CranioRehab.com. You can also reach out to either of us directly. Oh, there you go. Rob's there's my email, Schumann@CranioRehab.com. Or if you have a patient that you want to discuss as well, like that patient you just mentioned, please feel free to reach out to me. I'm always happy to bounce ideas off of other therapists and see if we can't come up with a plan that works with your patient, because obviously it's not one size fits all. All these patients have very unique complications and needs, and also, you have some patients who are really motivated and you have some patients that have a harder time staying compliant. So I'm always happy to come up with ideas with you of what we can do to help these patients. So feel free to reach out to us, to reach out to me. If it's a product idea, I'll probably pass it along to Rob, but please feel free to do that.
Absolutely. And when we send the survey and kind of participant questionnaire at the end of this, I will be sure to provide both Sarah and Rob's contact information so that that connection is possible. And I believe it's also on the handouts that you've linked as well there. So thank you. We have another question here about the populations that you see the NutriSqueeze bottles being used in for therapy.
Yeah, so those are, it's really sort of broad. So we see a lot of like post-surgical like recovery. So patients on sort of like soft and liquid diets, if they can't open their mouth. So I mean, strong trismus, but also like patients that are wired shut. And then we have like a stiff one, so it can find like very specific places. And that one can actually be used for cleaning as well. So if a patient has a limited opening, they can get in and sort of squeeze water in some different places. Yeah, but they're really like functional. I think the biggest thing is that, especially for patients that are maybe using syringes, that are trying to syringe feed, those are only 60 milliliters. Like it's just a not very big amount. So this allows a patient to do 8 or 16 ounces. So it allows them to just much easier access to a lot of that food. And we see, a lot of different, neurological issues, like different things that it's just one of those sort of like such a broad area of where people might need that, that we have those. And we're also, we've had like a mother with a child with autism that like was biting through straws. So we worked to find a little bit like stiffer straw that would last a little bit longer for that patient. And like we have a lot of like flexibility to like look for different things like that as well.
Yeah, and so the question even was asking about the use of that device for patients who have dementia. And so it sounds like you're saying there really is that flexible use that can be at least considered for people who struggle because of different things going on.
Yep.
Yeah. Awesome. Well, thank you so much for your time tonight, Sarah and Rob. We really appreciate you participating in the Foundation's Meet the Makers series. Following tonight's webinar, you all will be receiving a survey. So we'll ask you to just reflect on your experience with us here tonight and then provide any feedback that you might have. And just as a reminder, you'll also be receiving a certificate of participation. So this is our last Meet the Makers webinar of 2023. So we wish everyone a great new year. Thank you again for joining us. Have a good rest of your evening or day.
Thank you, everyone.
Thank you.